Scott Price never thought he'd trade his big red truck for a set of yellow wheels.
I was in the fire service for almost 24 years.
He was driven by the excitement, a desire to help.
You do have those moments where, you've delivered a baby or you've saved somebody's private property or their belongings.
But those other moments,
a lot of fatalities, numerous children, drownings,
shifted his life into reverse.
For any firefighter, children are difficult. For me, it was happening over and over and over again. A lot of calls that I would like to forget that I'm just never going to forget.
The one he couldn't bring himself to tell us about, the 2012 death of Savannah Edwards, fatally mauled by a dog. In the months and years that followed, Scott saw the changes.
You're not the person that you used to be. I was a little more fatigued, a little more temperamental. Nightmares so bad I wouldn't even want to go to sleep. For a while, I thought it was something that we all dealt with.
Finally, this spring, Shawnee Heights Fire Chief Tom Garcia pulled Scott aside.
It was affecting his family life. It was affecting his work performance here.
Together, they got Scott into treatment, where he was diagnosed with post-traumatic stress disorder. Garcia says it's not surprising, since firefighters today do more than just put out flames. They're also the first responders for anything from wrecks and assaults to medical calls and suicides.
It's the day in, day out. We can't get away from it, because the next day we come to work, we don't know what we're going to be faced with. So when we get up in the morning, we try to prepare ourselves for the worst.
Trauma rewires the brain.
Clinical therapists Jill Reese and Mary Evans say PTSD is very real. The brain becomes stuck in fight or flight mode.
They continue to live with intrusive memories, distressing memories, flashbacks, dissociations. Maybe they start avoiding things.
The good news is it can be treated, but it takes an individualized plan of therapy, sometimes with medications.
Their mind, their body's been hijacked by the trauma. We teach people skills such as relaxation training, mindfulness skills, so they can kind of develop a sense of mastery over some of these symptoms.
The first step is trusting there is help, which is where the 1033 Foundation comes in.
Because it's all about how this person's being affected.
Named for the common signal code of officer in distress and the verse in Luke, where you'll find the biblical story of the Good Samaritan, 1033 Foundation trains first responders to encourage peers to reach out and take the first step. Soldier Township Fire Chief Carl McNorton helped launch it here in March when he saw how handling several tragedies involving young people in recent years was affecting his crews.
It's really critical to us and to me personally that we do what we can to help each other and help prevent this, because I'm an old firefighter and I want to make sure a young firefighter gets to be an old firefighter.
Because they know what's at stake. October 15th, Indian River County, Florida Battalion Chief David Dangerfield posted on Facebook, "PTSD for firefighters is real. 27 years of deaths and babies dying in your hands is a memory that you will never get rid of. My love to my crews. Be safe. Take care." Less than 3 hours later, Dangerfield drove to the woods, called 911, and took his own life.
We are working in an industry where being macho is what we should be. We're going to run into a burning building, we can save everything. That's not reality. We can't save everything. We need to be macho enough to say, hey, I'm a big enough man to step up and say, there's something wrong.
Which is why Scott is speaking out.
I know there's more people out there. I've seen the look.
He ultimately decided to take early retirement from the fire force and steer in a new direction, but he wants his friends to know they don't need to travel as far down the dark road as he did.
Just listen to the guys and just say, look, you might be in trouble or I am in trouble and I need help and I need you to listen to me.
Watch the balloon.
10-year-old Benjamin Peterson is quick with a laugh and loves cars.
Whoa!
But as an infant, his parents noticed something different.
He didn't roll over, he took a long time to walk. Repetitive behaviors was another one. He just likes to spin things. He'd sit around and spin our toilet paper, and we thought it was cute until we'd go through 10 or 12 rolls of toilet paper,
Testing revealed Ben had autism.
It still feels like kind of a punch in the gut, but at some point it was kind of like, okay, well, it's final. it's diagnosed, and we're able to get some help for him.
How about you do one more?
Much of that help came when Ben started school at Elmont Elementary.
Our vision 5 years ago was we needed a program to support our students, and we didn't have one.
Annie Dietrich was Elmont's principal when the Seaman School District started developing a program specifically to help students who are on the autism spectrum and need more specialized instruction.
Endless cycle of.
It's evolved in bits and pieces, tucked in corners of the building, and this year, when Elmont debuted its new expansion, they also debuted the structured learning environment. They call it the Star Room.
This room is different because it truly is individualized to meet every student and their needs. Everything is based on what they need and where they need to move towards.
There you go.
The room is equipped with tools to address the various sensory and stimulation needs children with autism may need to remain calm or regain focus throughout the day.
Academics is a component of it, but most students who have autism are close to grade level or working at grade level academically. It's just the other needs that they have. Socializing and a lot of the language pieces, that's what makes it most difficult for them to be most successful in the classroom, not so much that they don't understand the concepts that are being taught.
And in fact, that's the goal. The room is meant to be a break.
They're students like any other student here in the building. Most of them, over half their day is spent with their grade level peers in the classroom. But that program and that classroom, the room really meets their needs.
As part of the program, all of Elmont's staff receive special training on meeting the needs of students with autism. And as the program has taken shape, they've seen changes in all their students. Like earlier in April, when the whole school donned blue to mark Autism Awareness Day.
It takes care of some of those misconceptions that students develop, that society has, and we're breaking down those walls. More of ability awareness rather than disability.
Ben's dad couldn't agree more.
It's nice that other kids are able to see this and then they can ask questions about it and then they understand what's going on.
He says Ben is flourishing.
I don't know how we would have done it without it.
Bye.
And getting ready for his future, just like any other kid.
And I just hope he finds what he wants to do and that he's able to do it one day.
Experimenting. Lots of little dots in many colors.
Heather Ryan's story has always revolved around children.
A polar bear in a snowstorm, she said. That's a lot of fun, just to see them get excited about something new.
She never imagined her next chapter would involve a fight for her life.
It's still surreal to think that I was this close to not being here.
The plot twist came just over a year ago. Heather was training for a half marathon and planned to go out for a run, but a sick child and a flooded laundry room sent the morning into chaos.
I was like, I just feel kind of weird. I'm going to go sit down and it'll go away, but it didn't. It just went from that jittery feeling to pressure on my chest, or like a corset just being tightened around my chest and my back. My fingers felt tingly, and then it kind of worked its way up my arms.
Heather had her husband call 911. EMTs arrived at their home north of Junction City within minutes, did an EKG, and knew at age 34 Heather was having a serious heart attack. They broke standard procedure by calling Lifestar directly to the home to fly Heather to Stormontville's cath lab instead of first taking her to Geary Community Hospital, a call for which Heather recently had them recognized by the Geary County Commission.
The cardiologist at the hospital said if they hadn't done that I wouldn't be here, most likely. So that extra time would have been just too much.
Also vital, the fact Heather recognized her symptoms needed attention.
Women have a higher tendency to have the atypical symptoms, such as the nausea, heartburn, back pain, and fatigue.
If ignored, it can have deadly consequences.
The sooner it's recognized and an intervention can be performed to restore blood flow to the heart, more heart muscle is preserved and the extent of the damage is much less.
And get your dot colored.
It turned out Heather's heart attack was caused by a spontaneous tear in her coronary artery. She had double bypass surgery and spent a total of 16 days in the hospital before heading home to her husband and 2 children.
It was the only thing I could think of that day, as they're taking me out to the helicopter, was my kids. My kids need their mom. They're all spinning.
By January, she was back with these kids, and now she's even back to running a bit, excited to see how her next chapter takes shape.
Oh, it's like bubbles. There's just no words to explain how grateful I am that I'm here.
The college years, having fun in the prime of life, but also living at risk.
In this age group, you think you're invisible. Although you're healthy, you're also in a higher risk situation.
Infectious disease specialist Dr. Joanne Harris says the close quarters of dorms and apartments is perfect for spreading viruses, and she says many of them, like mumps, which recently turned up at K-State, can be prevented with vaccines. However, young adults may not even know what protection they have.
The last vaccine, I might have gotten one my freshman year of college. I honestly have no idea.
I got the flu shot last year.
An annual flu shot is just one recommendation for people of most any age, including college students.
They're healthy, and that's terrific, but influenza is a nasty illness.
Among other vaccines for young adults is meningitis. The Kansas Board of Regents now requires it for students living in residence halls.
It is a disease that can be rapidly fatal.
In fact, Dr. Harris suggests teens and parents also consider a separate vaccination for the B strain of meningitis. The CDC also recommends both young women and young men receive the HPV vaccine. It's shown to be more than 90% effective in preventing cancers associated with the virus, like cervical cancer and throat cancer. But Kansas ranks last in the nation. Fewer than 25% of girls and 20% of boys have the recommended 3 doses, which can be given as young as age 11. While HPV is spread through sexual contact, Dr. Harris says parents should not see the vaccine as promoting sexual activity.
It's cancer prevention. And so you want to give it and give it early enough that you limit any exposure to HPV.
Dr. Harris says college students and parents should go over immunization history if they're not up to date on childhood vaccines like measles, mumps, rubella, or chickenpox, or they're unsure. It's okay to get them now. A Tdap booster for whooping cough is a fairly recent add to the list for preteens and adults, especially pregnant women and those who'll be around babies. And even with that, you need a booster for tetanus alone every 10 years. Dr. Harris says fears vaccines are not safe are unfounded. She says it's not just about yourself, but those around you.
There's a herd immunity that occurs, that it's much less easy to spread the diseases within the community if the community has a certain level of protection.
They're putting more people at danger because if people were to just get vaccinated against it, these diseases could just be eradicated from the whole population.
When it comes to Zika virus, health experts say believe the hype.
I think it's a real concern.
Infectious disease specialist Kavitha Rao says unlike many other viruses which hit the very young and very old especially hard, with Zika the main concern lies with young adults in the prime of life.
The pregnant patients infected with Zika virus can transmit the virus to the babies, and there have been concerns of microcephaly in the babies, developmental defects, and fetal loss.
And it's not just women. While a bite from an infected mosquito is the main transmitter, a man who's been bit can spread it through sexual contact, and the virus sticks around a while.
If the men get infected with Zika virus, it can stay for up to 6 months. You're supposed to use a safe sexual practices. If the women get infected, you basically wait for about 8 weeks.
Dr. Rao says most people who contract Zika will never know, and even those who do have symptoms will likely only get a mild fever, rash, or joint pains. But she also believes the virus is just getting started. While Florida is the only U.S. state with locally transmitted cases, the mosquito which carries Zika is found in a wide area, including eastern Kansas. So young adults especially should take precautions.
If you're pregnant, do not travel to the endemic areas. That's probably the biggest warning. If you want to get pregnant in the next few months, I wouldn't recommend going there. And if the pregnant patients have traveled to an endemic area with Zika virus, you need to tell your OB doctor so that they can monitor for symptoms in the baby.